Good afternoon, and thank you for stopping by Across the Fence. I'm Keith Silva. Longtime viewers will remember that former Across the Fence host Tony Adams was a champion for raising awareness about ALS, amyotrophic lateral sclerosis, better known as Lou Gehrig's disease. Tony's wife Mary died of ALS in 1990, and until Tony's passing in 2020, he always made sure to talk about his experience as a caregiver to someone with ALS, a need for a cure to this debilitating and deadly disease. With me is Rup Tandan. He is the Professor Emeritus in the Department of Neurological Sciences at the Larner College of Medicine, a neurologist at the University of Vermont Medical Center, and the Director of the National ALS of Excellence. Welcome back to our program.
Thank you.
I say welcome because you were here when Tony was here, and you had many conversations with him, and you worked together a lot in trying to raise awareness. So
I did.
So welcome back, sir.
Thank you.
I think everybody knows what ALS is, but what is ALS?
So ALS is a neurological disease. It's a neurodegenerative disease of advancing age. And it's a disease that affects the motor neurons. So these are neurons or nerve cells that are present in the brain and the spinal cord, and they control motor function or muscle function. So these motor neurons degenerate in ALS, and that's what causes the disease.
No cure for ALS? Well, it's a lot of treatments and a lot of things have changed in your time studying this disease, which we'll talk about in a minute. How many Vermonters are currently suffering from ALS?
So in our central clinic, we follow about between 60 and 70 patients with ALS in a year, of which about maybe 20 or so come from upstate New York.
Okay.
And the rest are from Vermont.
Okay.
So about maybe between 40 and 45 new cases of ALS that we see.
So even though we hear about ALS a lot, there's walks and all sorts of fundraising for ALS, it's still a fairly small population, right?
It is, yes.
Not everyone is affected by this disease that widely.
Well, I would modify that and say that even though the patients are the ones who get the disease,
Sure.
the family is affected by the disease too.
Yes, very much so, very much so. And ALS is genetic.
The majority of ALS cases are not genetic.
Are not genetic.
They are called
Okay.
non-familial or sporadic.
Okay.
Up to 15% of ALS cases have mutations in different genes, and there are maybe about 40 plus genes associated with ALS now.
Who's at risk for ALS?
So that's an interesting question. So there are studies from epidemiology that have shown that people who have genes in their family, ALS genes in their family, are at risk, obviously.
Mm-hmm.
Advancing age is a risk factor for ALS. People who have had a very active lifestyle in earlier years are at risk for ALS. People who are lean and thin have an increased risk for many years before they get the disease, are at increased risk for the disease. And the corollary is that people who have obesity or overweight, they have a lower risk of ALS.
That is, and age range, is it an older person's disease or younger person's disease?
Yeah, so if you look at the peak age range, it is between 55 and 60 years.
Okay.
But the peak is the tip of the Gaussian curve. And if you go leftward of that curve, I mean, there are patients in their teenage years that I have seen who have the disease. And there are patients on the right side of the curve who are in their 90s who have had the disease.
So you could develop ALS in your 90s.
You can.
Or in your teenage years.
Or your teenage years.
Preventions, anything to do that, obviously, maybe not working out so hard in your early 20s, but other preventions that could happen with ALS?
I think that what we are learning in the last few years is that if you maintain your body weight, mm-hmm. Particularly if you maintain your body fat, that actually helps. It doesn't help to prevent the disease. Of course it does. It decreases the risk years before you get when one gets the disease. But if you have the disease, then maintaining your body weight, maintaining your body fat is associated with slower progression of the disease. And people who have more body fat, they survive longer. And we have published, work on this area, as has other people too.
Right. What does an ALS diagnosis look like? You find out you're diagnosed. What are you seeing in those early days? Yeah.
So when the patients come to see you first, they can have two types of presentations. So they can either have a presentation associated with difficulty with speech. So they may have slurred speech. So they are mistaken to be drunk, some patients.
Really?
Or they may have difficulty with swallowing. So that's one type of ALS. It's called bulbar ALS.
Okay.
And then the majority, 3/4 of patients begin with weakness or loss of muscle in, say, a hand or an arm, or in a foot or a leg. So like a foot drop or weakness in the hand, commonly mistaken for carpal tunnel syndrome. But I think further analysis shows that they don't have carpal tunnel syndrome.
Right.
So those. And then, so you take the history, you examine the patient, you look for signs of the disease, and then the testing is mainly, so experienced clinicians, neurologists, ALS specialists, can diagnose ALS without testing. But I think it's still important to test them for ALS mimics, or things that may look like ALS. And there are many conditions that can look like ALS. So the testing is mainly for those. And so testing can be an MRI scan of the brain or of the neck or of the back. It could be an electrical test called EMG, electromyogram. It could be blood test, could be a urine test, and rarely a spinal fluid examination or muscle biopsy or nerve biopsy can be required.
And what are the treatment options, sir?
So for ALS?
Yes, sir.
Yeah. So there are basically two kinds of treatments. So one is that you treat the patient's symptoms. Of course, you support the patient and the family psychologically. You treat the patient's symptoms. So, for example, the patients may have mood disorders, depression. Anybody learning that they have ALS, they tend to get depressed, obviously. You treat, say, if they have stiffness from the disease, you treat the stiffness. If they have emotional ability, some people get emotionally labile, they cry a lot. That can be treated effectively. You make sure their nutrition is maintained, their hydration is maintained, and that their breathing is supported. Because most people, when they lose their life from ALS, it is from respiratory failure. So you want to support their respiratory failure. And this treatment is best achieved through a multidisciplinary clinic, and that's what we have at the University of Vermont Medical Center here. So we have about 8 or 10 different healthcare providers who see patients and care for patients in ALS.
And you've been studying ALS your entire career. You started out 40 years at Larner at the UVM Medical Center. You said even before that, when you were a student. What have you learned personally about, as a doctor, dealing with this illness? Yeah.
So I think that what we've learned is that, number one, we have learned a lot about how the disease comes on in people, the clinical onset of the disease, how it progresses. So if it begins in a certain part of the body, we can predict as to how it will progress in the person. We have learned that research has shown us and other people that there are things you can do to help slow down the progression of the disease. So, for example, maintain their nutritional state. Okay, and give them medications that are known to affect the disease. So there are now, for example, 3 medications approved by the FDA to treat ALS. 2 for non-familial ALS and 1 for familial ALS due to a mutation in a particular gene in ALS.
And these are fairly recent developments, correct? We were talking about, someone with your long career, you've seen massive changes in how this disease has been treated, and you've seen a lot in the last 20 years that you probably couldn't have imagined when you were a student studying it back in the day.
Totally, and also caring for patients in a clinic like the one that we have here, it's been shown in other countries, like in Germany, in Ireland, in France, that when you have a team of people caring for patients with ALS, the results are better in those ALS patients than if they are not in a experienced team of ALS carers or providers.
Not to put too dark a pall over it, but this is a fatal disease. You know, I don't want to say death sentence, but ALS, there is not a cure for it. So there are an awful lot of things, like you said, psychologically, the impact on families, the impact on everyone else when someone comes down with ALS. Is that a big part of your work?
Yes, it is, yeah. So I'll maybe modify what you said a little bit, Keith. So it's a fatal disease. It's an incurable disease to date.
Incurable.
But
okay.
it's not an untreatable disease. And that's the point I was trying to make earlier on, that you can still treat patients with ALS. You can make life more easy for them, more convenient for them. You can improve their quality of life. And you can actually prolong their survival, allow them to function for longer by appropriate treatment of their disease.
We've got about a minute left, Dr. Tandan. One of the things that is in the news a lot is CRISPR or using genetic interventions. Is that something that ALS research is leaning towards now?
I think that it is early days for human ALS, but there are many animal models of ALS, and I think that people are trying CRISPR in animal models of ALS to see if by eliminating the gene responsible for ALS in those animal models, can they modify the disease expression in those animals.
I didn't even know animals could get ALS, but I'm glad we learned that. Thank you so much. It's wonderful talking to you. For ALS support, information, and resources, visit the website on your screen, als.org. You can type in your state in the information and get referrals and education and support in your area. I want to thank the crew behind the scenes here at WCX who make our program possible. I'm Keith Silva. This is Across the Fence. Thanks for being part of our family.